Welcome to Ivanoff Retirement Insights with Paul and Travis Ivanoff. The father and son team at Ivanoff Advisors has been helping clients grow and protect their wealth with a combined 50 years experience. Paul and Travis understand the importance of having tax-free, reliable income in retirement, protecting your assets, and helping you achieve your retirement dreams. Now, Ivanoff Retirement Insights.
Thanks for joining us today for Ivanoff Retirement Insights. Make sure to subscribe so you never miss an episode, because the Ivanoffs here are kind enough to break down the confusing, sometimes foggy world of retirement and all the pieces that fit together brick by brick. And normally each week we have Travis Ivanoff and Paul Ivanoff joining us, but making her debut on Ivanoff Retirement Insights is Sadie Ivanoff today. Sadie, how you doing?
I'm well, thank you.
On a previous episode of Ivanoff Retirement Insights, Paul shared with us how he kind of stole you from the nursing area and brought you in to be part of Ivanoff Advisors and handle the Medicare portion. Are you happy you made that decision?
Yes, I'm just getting older. It's hard to be on the floor on my feet, and I was high-risk labor and delivery. So, I like caring for people. I didn't retire well myself. I like to take care of people, and Medicare allows me to do that.
Well, I can imagine being a nurse for as long as you were, those long shifts, long hours. It's kind of a lifestyle change, but you couldn't just retire and that was the finish line, right? You wanted to expand.
Yeah, well, there's an intensity to labor and delivery. It's a personality. And so I like the intensity. So when you go into Medicare and open enrollment, there's an intensity to it, and there's people's fear. When somebody has a child or their family's growing, that fear is something that I like to take care of. Well, when you come in with Medicare, a lot of people are just really afraid of doing something wrong. They're afraid of getting into something that won't take care of their needs. They're afraid that if they, getting older, have some chronic illness or maybe have a trauma, and that's really real to them, that they need to pick a hospital and a doctor that they feel that they'll get the care that they need so that they have quality old age. And that's what most people are looking for, is a quality, healthy old age.
Well, and there's something about retirement in general. Everyone feels like they should have all the answers. But thankfully, we do have people like you that can help us walk through the retirement process, especially Medicare. Like you mentioned, it can be very confusing. So I do want to get into the nuts and bolts of it with open enrollment. Just breakdown. We're going to go very basic here. First, when is it and what are the important deadlines that we need to know?
It's October 15th through December 7th. And open enrollment is only for Advantage plans and independent drug plans. It is not for supplements. And so what's the difference? And part of the confusion. When you first turn 65, you have original Medicare A and B. A being hospital coverage, B being doctors, tests, and procedures. Well, that was set up to where you could go to any doctor in any state, you could go to any hospital in any state, and who is your in-network? It's Medicare. If that doctor and hospital takes Medicare, you can go freely. Your doctor says you need a knee replacement, you book the hospital and you get that knee replacement. Well, there's a choice right then and there of how do you cover the other 20%. Mm-hmm. You can either get a supplement plan, an insurance policy that covers it, and that one is one that you choose right off the bat and you stick with it, in the sense that you cannot opt to easily go into a supplement plan later, and it's not subject to open enrollment. Or you can take your A and B and you can hand it over to the carrier, and it's very lucrative for them. They say, yes, give me your A and B. Mm-hmm. And what we'll give you is we will give you some things that Medicare doesn't offer. We'll give you dental, vision, and hearing. And it's a very competitive market. And so what do you get when you first turn 65? A huge amount of mail saying, ooh, we have this, we have over-the-counter, we have chiropractic and acupuncture. We'll give you extra dollars if you get your physical. There's just a very competitive market, but you're giving up some freedoms. All of a sudden, Medicare is not your in-network. It is a certain doctor's group, and you have to go to that doctor's group, otherwise your medical will not be paid. And so that's the fear, is that somebody would choose to go to an Advantage plan for the savings, and then they would lose their doctor, or they'd end up at a hospital that they don't choose to go to. And that's where you see me. That's where you get a broker in. A broker comes in and makes sure that all your doctors and your hospital are in network, and that you get the care that you want. And you kind of problem solve when there's an emergency to make sure you get the care you need.
Well, and Sadie, you were talking about, the stacks of mail that can come in when it comes to Medicare Advantage. I mean, I see these ads everywhere online, billboards, so I'm sure mailboxes are just stuffed. For someone that is getting this information for the first time, they might be confused about it. What else should they know about Medicare Advantage plans? I'm sure there are benefits like pros and cons to everything.
Well, they're selling you something. So they are selling you on health. They're selling you on things that you choose when you're healthy. The thing that when you come in to see me, to remind you, health insurance is for when you're unhealthy. It's when you've had that trauma, that cancer, that heart attack. So I try to redirect you back to not getting distracted by the bells and whistles, but by, does this plan give you the medical coverage, the care that you want to get if something happens to you? Why did I bring up the supplement plan and having original Medicare? Well, some individuals want that freedom that if they get cancer, they want to go to City of Hope. I had a gentleman come in, and he had to have open heart surgery, and he was scared to death of it, having his chest open. I live in California. He went all the way to New York because they were doing the first surgeries on the heart without opening the chest. They were going through the auxiliary artery, and he had his surgery there fully covered and paid for, because that's what original Medicare and a supplement gives you. But most people, a lot of people, they're going to go with their favorite doctor that they've seen for 20 years, and that doctor says, oh, you have cancer? Well, I'm going to send you to this doctor, oncologist. This is where you're going to get your cancer care, and they'll just follow along, and they're comfortable. They don't want any choice. An HMO plan is perfect for that. And then for those that are kind of in the middle, that want to have some choice but not too much, a PPO plan works. And so that's kind of how we help separate some of the choices, and I help figure out what's most important to the client.
It sounds a lot like how Travis and Paul will be on the podcast talking about how nothing is cookie cutter. Every single person is different and has different wants and needs.
Absolutely. Absolutely. And it's just so much fun because when we're in there, I mean, I'm a nurse, so people don't mind sharing with me some of their medical situations and their fears. Some have older parents that they're taking care of, and they want a plan that takes care of mom or dad at home, and they're worried about their driving abilities and having a companion come to the house. Certain Advantage plans will offer that. Some have VA coverage that they didn't even realize for long-term care to help out in some of the situations. It's really nice to get to know people, and then they call me. They call me when something has happened to them. Sadie, it's happened. What do I do? And I kind of help them take the fear out of it and walk them through some of the questions you'd ask to get the best care possible.
Well, it's nice that they have someone to turn to. So when does someone need to start thinking about their options for Medicare? When do they qualify?
Turning 65, unless you have disability, you can go into it younger, but turning 65. And it doesn't matter what your income is. It's just turning 65.
Okay.
And then what do? 3 months before, you go to SSA.gov, which is socialsecurity.gov, and you sign up online. And then there's those people who don't need their medical insurance through Medicare. They get it through an employer. And those people can hold off signing up for Medicare with no penalty as long as they have employer-covered health insurance. And that's a fear that a lot of people have. I'm 65 and I don't want to get the penalty, so I'm just going to sign up even though I have employer insurance. They don't have to. They will not get a penalty as long as they have employer insurance.
When you bring up such a good point in that penalty is that nobody wants to make a mistake in retirement because it can just be so costly. So when someone does go ahead, they sign up for Medicare, are they set, or is there a chance to kind of change things maybe the next year?
Well, signing up for Medicare means you have an 80-20 plan with the government, and Medicare covers 80%. And when and how you cover that 20% is why you see someone like me, and that's the Advantage or the supplement, or VA, TRICARE. So there's several ways to cover it. And some employers, if you retire, go into you get retired from your employer, some of them will offer to pay your Part B premium if you stay with their retirement plan. But they don't know how good those plans are, so they'll often just sit down with me and we'll go through them. But that is something to bring up. Part A, there's no premium to it, so a lot of people, even though they continue to work and have an employer plan, they'll sign up for Part A just to have a secondary hospital insurance because it's free. Well, you've worked for it all your life, but you don't pay any premium for it. Part B, you do. And it's based on your income, how high that premium will be. And so just to have that awareness that you will pay a premium for Part B, starting 2025, it's $185 a month per person.
Well, and those are things that you need to kind of compare and contrast when you sit down with Sadie. Sadie, before we close out the show, is there anything that we missed as far as Medicare is concerned?
It is a good deal. I think that oftentimes we look at the government things and think of them as negative. It is a good deal to have that kind of freedom or choice of freedom to be able to see any doctor, any hospital in the U.S. and have it covered. It's just a phenomenal deal for $185 a month. And you've worked for it your whole life. It is not an entitlement. This is something you have saved up in your account. And I think be proud. Be proud.
Well, thank you so much for joining us, Sadie. Thank you for clearing it up. I know I have had friends, they've gotten into retirement, they say Medicare, they look at it and they're just confused. So I appreciate you being a resource. And if you want to get some more information from the Ivanoffs regarding your retirement, how to make all the pieces come together, reach out to the team at ivanoffinsights.com. And thank you so much for listening.
Investment advisory services offered through Ivanoff Wealth Management, a registered investment advisor firm. Registration is not an endorsement by security regulators. By contacting us, you may be provided with information about insurance products, including annuities offered through Travis Ivanoff, California CRD number 325275. The firms are separate entities. Annuity guarantees rely on the financial strength and claims paying ability of the issuing insurance company and are not offered by Ivanoff Wealth Management Incorporated. Read your contract for restrictions, limitations, or penalties. Ivanoff Wealth Management is not licensed in all 50 states. To find out if Ivanoff Wealth Management is licensed in your state, please call 714-553-1490. Ivanoff Advisors is not affiliated with Ivanoff Wealth Management Incorporated. Advisory services are offered by Travis Ivanoff through Ivanoff Wealth Management. Insurance services are offered by Paul Ivanoff through Ivanoff Advisors. The aforementioned are unaffiliated companies.